The number of active cases of COVID-19 in the country has crossed 3,000. The latest update from the Ministry of Health says there are some 399 new cases of COVID-19 and 4 more deaths due to the virus. The COVID-19 death toll now stands at 189. The ministry says the patients were a middle-aged man without pre-existing health conditions, a middle-aged woman with comorbidities, and 2 elderly men, 1 with comorbidities and 1 without. Of the known active cases, 276 are patients in hospital. 2,307 persons remain in home isolation. Since the first case was reported in March of last year, 12,105 positive cases were reported in Trinidad and Tobago. 55,259 people have received the first dose of the Oxford AstraZeneca vaccine, while 288 have received the second dose so far. Principal Medical Officer of Institutions, Dr. Miriam Abdul-Richards, continues to be concerned about rising COVID-19 hospital occupancy rates, noting a 10% jump in the last few days. And with a shift in pattern where younger people are succumbing to the virus locally, she is urging the population to adhere to public health regulations now more than ever. Sunilala reports.
On May 3rd, overall hospital occupancy rates in the parallel healthcare system stood at 48%, which increased to 50% by May 4th. But Principal Medical Officer Dr. Miriam Abdul-Richards says that figure jumped to 58% on Tuesday afternoon, and she is worried that occupancy rates would be overwhelmed in the next 7 days. The number of people on the high dependency unit is even more concerning, jumping from 40 to 70% overnight.
Our ward occupancy rates have increased within 24 hours from 50 to 60%. Which is a 10% increase, and our ICU occupancy rates have decreased from 50% to 40%.
But she says the percentage decrease in ICU is not due to patients being discharged, but because of a rise in deaths in the last few days. Dr. Abdul-Richards is also warning the younger population to take heed of the virus due to the shift in pattern where young people in their 30s have been joining the list of COVID-19 victims. She warned against the concept of creating COVID-19 bubbles, since young people could be asymptomatic and spreading the virus.
Young people, we are seeing deaths and sudden deaths from the 30s onward. Please don't think you are immune. Please, this concept of a bubble that I've been hearing touted around does not work.
Epidemiologist Dr. Avery Hines is also warning the younger population of congregating during this critical period, especially with the news that younger people are being affected severely by the virus.
And what it does is it serves to remind younger people who sometimes forget that this virus can indeed have adverse and fatal outcomes in younger age groups. It reminds them that they are not immortal, they're not immune to the adverse outcomes.
Dr. Abdul-Richards is cautioning people not to congregate or mix with others at the supermarkets during these dangerous times. Sonolala, TTT News.
10% of COVID-19 samples sent for genetic sequencing at the UWI St. Augustine campus have so far been confirmed to have the Brazilian P1 variant. This according to Professor of Molecular Genetics and Virology, Christine Carrington, who notes that this percentage does not reflect the prevalence of the variant locally. She says of 476 samples received for genetic sequencing, 375 have been sequenced, 74 are currently in process, and 27 of those have been deemed unsuitable for sequencing.
175 sequenced from Trinidad and Tobago. To date, about 10% are of the P1 variant, which, as I said, was first detected in Brazil, and as you are aware, was first detected in Trinidad about 2 weeks ago. I should emphasize that the P1 is the first variant of concern to have been detected in the general population in Trinidad and Tobago.
Professor Carrington maintains that the AstraZeneca vaccine still provides some level of protection against the deadly P1 variant.
And when it comes to the vaccines, while some vaccines may be less effective against P1, a recent scientific article, for example, this one is not yet peer-reviewed, showed very good evidence that antibodies from people who received the Oxford AstraZeneca vaccine and also those who received the mRNA vaccines, they were able to effectively neutralize P1.
She reminds that the P1 variant has been seen to be highly transmissible and is urging the population to take all precautionary measures.